Okay, welcome to our not last session because we have tomorrow, but our last session of pharmacology together. Um, we have our quote of the week. We're gonna do an escape room. We are going to escape Module Three's pharmacology course. We have a Quizlet. For those of you who haven't had the opportunity to complete the survey, you will have time this evening. Now, if you have, you get a little bit of break. Um, your Kahoot, I'm thinking that I'm probably going to just put it in the archive for time purposes because I really want y'all to have some time just to kind of reflect and um, take some time for yourselves this evening. I try not to keep you long on finals weeks for that reason. And then we're going to wrap it up. Okay. So let's get into our quote of the week. This quote of the week carries a powerful reminder of the commitment and dedication that defines us as surgical techs. Again, I couldn't find who wrote it. It was just anonymous, but I liked it and I was like, we're going to go with it. So here's the quote. The operating room is my heart and soul. One patient at a time. You never know when it will be you or a loved one that's on the table. I am there for every patient every time. Now, this quote emphasizes the importance of compassion, responsibility, and being present in each and every moment. As surgical techs, we are entrusted in our patient's safety and we care for each and every patient that comes on our table. It doesn't matter who they are or what they may be an expert at. It reminds us that the work we do goes way beyond the technical skills. It's about making a real impact one life at a time. So, this quote, I hope it inspires you to continue your journey. You're almost halfway. Like next module, you're back with Mrs. Hughes. You're going to be with Mr. Caldron. He's amazing in the lab. You're going to be going through surgical procedures. Your pharmacology gets replaced with lab, right? But then you're actually in the environment. You're gowning, you're learning to glove, you're looking at sterilization, you're actually placing items in a sterile pan, you're grabbing your case card, you're looking at your surgeon's preference card. The best is yet to come. So, with that, I have to do some reminders. The last day of the module is Saturday, 20 September, 25, 11:59. With that, y'all, I always say it, set yourselves up for success. Now, if something does come up, immediately email me, text me, because then I get a timestamp. So even if I can't get to you like that moment, I have a timestamp that says, hey, such and such did reach out. What can we do and move there? Okay. But set yourselves up for success. Um, this is like crazy. You guys, again, the average in this class is an A, and that's because you guys are putting in that work. Okay. With that, I will be doing your professionalism like you're used to. I just write down what I see, and they're pretty much done. I'm just waiting for the majority of the class to be done with their finals. That doesn't mean stress. Don't be forcing it. Don't rush it. But just so you know, if you don't see it yet, it's because I'm kind of pacing myself as well. All right. Now, don't be nervous either. I just saw, don't be nervous because you're not going in there alone. Like, you guys are actually going to be able to see each other, right? Like, you guys have been in the module together, three modules, but now you get to actually build that true teamwork, that true friendship. I know I've said it before. Some of my best friends, we went to tech school together back in 2000 and we're still friends. We've shared different things. Some have gone to be nurses, PAs, professors, and we still have that love for surgical technology. So keep that in mind. And when you do connect and you find those connections, keep them because you never know how life turns around. I have students that I taught as a civilian instructor, and our paths have crossed, and we're great friends. I even ended up going through school with one of my former students and we're friends. So I say that to say is you never know what can happen in the future. So I always take it or make it a point to treat everyone as if, you know, we could be colleagues one day. And you never know when things turn full circle. With that, you guys ready to try something different? I'm a little nervous because I've tried this a couple times. Um, we're gonna do an escape room now. Is it getting? It's getting confused. Hold on. Let me. Okay, we're going to the escape room as I try to get the escape room in. So I'm gonna actually share the escape room with you guys. So if you want to try it on your own, you'll be able to. Hold on. Okay. So how does this work? All right. So we're gonna go through different little questions. Our goal as a team is to make it out of the escape room. You can tell I just watched that movie, so I was like, huh, let me try it. All right. So if you have it and you want to go along, go right ahead. I have the answers, just so you know. So we're not going to be here forever, but I just want you guys to kind of see how this would go. So I'm going to go ahead and click next. Okay. So we start off. Okay. So our first challenge is our dosage dilemma. Okay. We got to get out of this. A patient requires 500 milligrams of a drug, but the available vial contains 250 milligrams mLs. How many mLs should we administer? So we have 500. Let me put in two and see. I got an answer. Yes. Okay. Oh, you guys feeling good? All right. Now, our next challenge is drug detective. What drug class does fentanyl belong to? What drug class? Let's type it in. Let's see what it says. Okay, let's try again. Think about how do I explain it without giving the answer? Hold on, let me see how I can.
Is it opioid?
Haha! I was trying to explain it without giving it. Okay, let's try it. Let's type that in. Boom. Okay, we got it. Two down. How many more rooms we got? Doesn't matter. We've got this. So now we're looking at the antidote mystery. What is the reversal agent for heparin? What is what is it? What do you guys think? You guys can use the internet. You can use anything that you have. Um, just so you guys know. Okay, I'm gonna type in what you guys are writing. Let's try thrombin first. Okay, the next one was norepinephrine. Any other questions? Anyone looked it up yet? The reversal agent for heparin. I'll give you a hint. Starts with a P. Ah, there we go. Let's type it in. Okay. Now we're at challenge 4. So we've gotten through 3 so far. We're getting into some little anesthesia. What type of anesthesia is commonly used for a C-section? For a C-section. What do you guys think? Okay. I have to be able to spell. Okay. It's injected into the subarachnoid space. So let's type in epidural. I think it's more broad. So you're kind of on the same spot. I'm going to go
Is
ahead and
it
type it in.
spinal? Like spinal
Yes.
block?
Spinal block. Yes. All right. Now we've gotten out of that room. Crazy, right? We're just in that one room. In this challenge, we have to recall facts about how medications are developed and regulated in the United States. Now, according to the book, which agency is responsible for approving new medications in the United States? I like this one a little bit easier because we have choices. Okay. And which phase of clinical trials focuses on safety and determining side effects? Is it phase one, two, three, or four? Do you guys remember? I see one. We'll try that one first and see if we get through. If we don't, we'll go back to four. Haha. So it was one. All right. Now, we're still in medication administration, right? The challenge now is to test our knowledge on the proper technique of administering medications. So, which of the following is the correct method of administering an intramuscular injection? Is it 90 degree, 15, 180, or 45? What do you guys think? 90? Okay, we'll try 45. All right. What does the term parenteral administration refer to? Is it oral medications, medications injected into the body, topical, or suppositories? Okay, let's see what it says. All right, you guys ready for the next set? We're doing good. We're doing good. How do you guys feel so far? Feeling good? All right. Which of the following is an example of a broad spectrum antibiotic? Tetracycline, Vanc. Okay. What is the primary concern with overuse of antibiotics? Is it increased efficacy, antibiotic resistance, lower cost of medications, or reduced side effects? I see antibiotic resistance. Let's go and type it. Fingers crossed. Let's see how we do. Okay, moving along. Which of the following is commonly used to treat glaucoma? Is it, haha, I already see it. What is the purpose of using mydriatic agents in surgery? Remember, one does one, the other one does it. Are we trying to dilate? Are we trying to reduce intraocular pressure? Are we trying to lubricate the eye or treat eye infections? You guys can look it up. Yep, I see the answer. Congratulations, everybody. Is that how you do it? The little things. You did it. You have solved the challenges and have successfully escaped the module. I'm supposed to put module, I put semester. Your pharmacology knowledge will definitely serve you in the surgical field. Best luck to you all. So I just thought this was a little bit kind of fun way to kind of bring it all together. Again, you guys can redo this as a um, additional resource if you haven't taken the final yet, just to kind of feel a little bit more comfortable going into taking this final exam. So and you guys can even make your own little escape rooms. I think I just use Google Docs. I just use Google Docs and kind of like set it up so that if you missed one, you had to go back. And it really just challenges, and you can put in any type of questions, not just for pharmacology, but once you guys get into your mod 4 and you're looking at those surgical procedures, and when you're trying to break them down as far as like, okay, what instrument you're using here, you can kind of tag things in. So again, I put that into the chat so that you guys can have it. And again, you can kind of use it as a template and copy what you see and make your own. Okay. Now, your Quizlet, because I do want to get you guys out of here earlier than normal, but your Quizlet, I'm going to actually, because Quizlet's a little bit longer, I'm going to get your Quizlet, I'm going to put in your archive. I really want to give those of you who have not had the opportunity yet to complete that survey to go ahead and do it. And then for those of you who have, go ahead and take a break. And then I will see everyone back when the timer goes off. as we get ready to prepare for the final, I wanted to kind of go over some things to expect, okay, what you may see. And this is for those of you who have not taken the final note. Granted, I know that there are a lot of different questions that may be pulled, but I wanted to get a couple concepts just to kind of mentally prepare you and let you know that you have the information, you're going to do well. Okay. So again, time limit is 45 minutes. You have 60 multiple choice questions. So I grabbed five concepts and kind of like change different numbers and stuff just so you can kind of see what you may see on the final. So let's go through these together since we're here. Now I'm going to read them again because you may see concepts close to these. So the very first question or concept that I saw was looking at irrigation, kind of like we did in the escape room. Which solution may be used as irrigation solution at the sterile field during an AV fistula insertion? So you'll have a couple choices, right? You may see 100 units of heparin, 1,000 units of heparin, 5,000 units of heparin, and 1,000 milliliters of saline, and 10,000 units heparin and 100 milliliters of saline. Now, I'm going to give you the rationale for this first one, okay? Because I feel like it's important. So keep in mind that heparinized saline is commonly used in vascular procedures. Now, I know you guys haven't got to procedures yet, but remember, we are we have planted the seed, right? And so that when you guys start getting into those procedures with Mrs. Hughes, it's all going to come together. So just know heparinized saline is commonly used in vascular procedures to prevent clot formation, which remember, that's not something that we want to happen in the operating room, especially in our grafts or our fistulas. Now, the concentration has to be strong enough to prevent clotting, but not too concentrated to cause complications. So the standard irrigation solution in this particular instance is 5,000 units in 1,000 milliliters. Okay. So if you see concepts on like irrigations and different things, kind of take a deep breath and then think about all the things that we really did talk about in pharmacology, especially when it comes to potassium overloads. When we look at normal saline versus lactated ringers versus distilled water, things like that. Okay. Another concept that I'm going to break down for you guys. What are the 5 phases of general anesthesia in the correct sequence? You may be asked sequential questions, maybe not necessarily for induction or phases, but kind of like, okay, what do you do first, second, and third? And so you have different um, options: emergence, pre-induction, induction, maintenance, and recovery. Now, for a question like this, go back to when we kind of really broke down these concepts. Okay. Um, what do we want to do first? Okay. Are you going to jump into induction and then backtrack to pre-induction and then recovery to maintenance to emergence? Think about what we talked about when those 2 times where the patient is very agitated, right? They could wake up. Was that pre-induction? Was that emergence, right? What would maintenance be? Are they already induced? Okay. So kind of put it in, kind of like go back in your mind. I know that when you're taking that test, sometimes you get stressful, but kind of think of that. When you look at the correct order, where patients being assessed, they're given oxygen IV. That's pre-induction, right? Once the anesthetic is in their body, their airway is secured. Remember, that's the big one. The airway is secured for induction. Once they have been induced, we just got to maintain, keep them stable, right? Now, once we hear final stitch, or you see the resident getting ready to start stitching, you'll know what that means when you get there. Then we're going into that emergence phase. Anesthesia is going to start to discontinue. The patient starts to wake up. So if they've already in that process of waking up, what's left? Recovery. So sometimes it's going to be like just breaking down the different parts as you're going through the questions, not just for this, right? But as you guys continue to move forward. Next question. What prep solution is acceptable? We talked about the eyes, including the eyelids, the brows, and even the cheeks. Think about the anesthetic prep for any type of periocular surgery. Um, you're going to have different options. Okay. When you see those options, start that process of elimination already. Like, okay, out of these, which one we definitely do not want to put in or around the eye because we know that it can cause injury. Are you guys with me so far? I'm going to come up with two more. Okay. Now, another concept that I saw, and I randomly grabbed them just so you guys know. What is the main role of the surgical tech during the induction phase of anesthesia? Now, this ties in with the question that was asked earlier. Think about what's happening during the induction phase. Remember those times where the patient can kind of get startled, right? Is the induction phase one of them? If it is, what is one thing that we would normally do as a tech? You may see options like administer sedatives, monitor EKG readings, provide an IV, maintain a quiet and prepared sterile field. Okay. Again, you have to know the phases so that you can mentally put yourself in those spaces. And the last question that I kind of randomly grabbed was what patient concept, what patient factor does not influence the selection of general anesthesia? So we think about what does influence. So we start there and then we go back to not. So if you get what does and you see the options like age, preference, cognitive ability, length of hospital stay, hypothetically, let's say, right? So we know that some of those are definitely going to be reasons why one anesthesia is going to be chosen over another. That's an easier way, right? Because then it's like one of these is just not the other. But let's say you had two options that were kind of close. So, for sure it's a patient's age, for sure it's cognitive ability, but you're not sure on preference or length of stay. Then you kind of go back to we are all about patient centered, right? We want to make sure that we're doing the best. We are the patient's advocate, no matter what part of the team or where we are in their treatment. So then we have one option. Okay. And that's another way as you guys are going through these exams to kind of process of elimination in reverse. The easiest thing is making sure that you're like not rushing through and you're seeing those not always maybes and ands because sometimes they can kind of sneak in and throw you off. Okay. This is where take a deep breath, know who you are, and kind of pick the choice. So this way, when you're reading them, you're not just kind of data dumping because a lot of this you're going to be doing in real time or you're going to see in real time, but you're actually kind of putting yourself in the spaces. So then once you get into the space, it's like muscle memory. You're gonna hear that a lot, muscle memory. Your body's gonna automatically know what to do. Trust me. There's been many cases where an emergency happens and we're just moving. Like literally, we're just moving. We see what we need to do. We know what we have, and we're kind of making sure that we're doing the best for our patients. How does that sound? Okay. Now, this is where I turn it to you guys. What questions or concerns that you have going into the exam? And I hadn't had the opportunity. Normally, I try to look to see who's taken it so far. For those of you that may have taken it, what advice can you give to your cohort, soon to be face to face, on not answers or anything, but to kind of make them feel confident walking into this final exam? So this is where I turn my microphone off and then I hand it over to you guys. Because remember, we are a team. We're not giving answers, but just kind of advice, confidence, going into this final exam. Don't be shy. Y'all gonna be seeing each other. All right. Go over your quizzes and practices. Thank you. Thank you. Go over your quizzes and practices. Um, I finished my exam yesterday and it really tested me in many ways. The hardest part was feeling like I didn't know anything, second guessing myself. Just don't overthink. You have the knowledge. I did good on my exam. ST300 was harder for me, so I'll have to check to see. Um, Great advice. Biggest thing that she said, or yeah, biggest thing that Yeni said is you guys don't second guess yourself. Y'all really do know this information. I promise you, you do know the information. Review previous assignments. Thank you. Flashcards. Yes. Don't stay too long on a question you're stuck on. Just flag it and move on. That's also a big one because I know for me, I have really bad test anxiety, believe it or not. And if I stay too long on a question that I don't know, it'll discourage me for the next one. So I've taken that on where if a question I'm not that comfortable with, I'll flag it and then go to the next one that I'm very confident with. And then I get my confidence back and then I go back and then I'm like, okay, I'm good. I got it. Um, and then sometimes it's like, okay, all right, let's try. But the biggest thing is I totally agree to not kind of get stuck on one. Flashcards are great. Definitely, definitely. As promised, read questions carefully, especially, yes, except for those are those ones. Remember, I was telling you about those trickier ones. Except for is also a part of the not, only, always, never, that you have to kind of really almost put the brakes. Don't stay too long on it, but put the brakes and make sure that you really are comprehending that entire question before you're, picking your answer. This is really good, y'all. And you guys carry this on into module 4, especially when you start getting into those procedures, because somebody might understand a procedure way better than someone else, especially if you have it in your heart and you're like, you know what? I really want to, I'm gonna go there. I really want to go into ortho. So you're like mastering orthopedic procedures. And then someone who is like really good in cardiovascular procedures, help each other. Okay. There's many a times, even to this day, if I'm doing a case that I hadn't done in a while, I'm gonna go to that service senior and be like, hey, I hadn't done this in a while. This is what I'm thinking, make sure I'm good, because at the end of the day, it's about my patient, right? It's not about anything else. It's about my patient. Do you have any advice on learning the difference between the surgical instruments? Great question. This is one of the trickier ones to kind of answer because with the amount of instrumentation that there is, you're really gonna, and I know I'm already going to hear I can't believe she said this. You're really going to get more comfortable once you get into the actual operating room. And the reason I say that is because even to this day, there's going to be more and more instruments. There's times, especially like I'm an ortho tech by trade, trauma, neuro, cranies, some cardiovascular. If you put me in an eye case right now, there's instruments, the basic I'm definitely going to know, but I'm still going to have to ask, hey, let me make sure I know what this is. That's kind of like the the nature of the beast, because there's so many. We're going to make sure you are prepared to go into that operating room. Once you get into the operating room, your preceptors are going to make sure that you are ready for that facility with those instruments. What you need to know for us is making sure you know those basics. Trust the process. I promise you, trust the process. Let's see. Hold on. Okay, you guys are talking about the clinical orient or the lab orientation. I saw that. I think Miss Shroom sent you guys an email. Okay. And Alexandria, I don't want to, the biggest thing is don't stress. I really don't want you to stress. Um, Once you get into the lab and you start getting the basics, you get your hands on, get that muscle memory. Once you start going into those more specialized services, because you guys all will, then you'll know exactly what we mean when we're like, trust the process. You're going to definitely be prepared to walk into the operating room and perform surgical procedures. Okay, what if we reach out to Mrs. Shrooms? She's going to be your point of contact, and that's a great question. Question is, what if we can't make the orientation? Just make sure you reach out to her, and she will definitely be able to kind of set whatever you guys have to do, because that's going to be really big, right? Because that's the next step going into the latter end of module 4 with You're learning your surgical procedures, but good questions. 3 p.m. Okay, so you guys are talking about that. And this is what you guys need to do. I highly, highly encourage you guys to make sure you're helping each other, not carrying, but helping each other as you continue to go through with the rest of the module. Now, for those of you who are watching the playback, looking back over the course, what topic or concept did you find the most challenging in pharmacology? If you could give one piece of advice to a student starting this program next month, what would it be? And which skill from this module in pharmacology do you see yourself really, really using, especially with pharm, in the operating room setting, and why? The quote of the week is slightly different, right? The operating room is my heart and soul, one patient at a time. You never know when it will be you or a loved one that's on that table, and I'm there for every patient every time. Again, I don't know who it was by, but I loved it and grabbed it. Now, I do want to thank you guys for being here this evening. I don't want you to stress about the pharm final. Your class, y'all, this cohort has been phenomenal. Take that going in. Again, if something arises, send me a message as soon as you can. Okay. Please have a wonderful evening. And I look forward to seeing everyone who can attend our ST300 live session tomorrow. With that, good night, everyone.